From the Library of Congress in Washington, D.C.
Good evening. Welcome. Thank you so much for coming. I'm Ann McLean from the Music Division of the Library of Congress. Thanks for your patience while we were working on this IT situation here for a moment. I'd like to welcome all of you to a Music in the Brain weekend here at the library, Wellness and Growth, Acoustic Medicine and Music Therapy. We have 2 distinguished speakers this evening and 2 more tomorrow afternoon. Dr. Jayne Standley is director of the music therapy program at Florida State University and one of the foremost authorities on medical music therapy with pioneering research in this field. Vera Brandes is director of the research program Music Medicine at the Paracelsus Medical University in Salzburg, Austria. She is a noted researcher on music and media effects, committed to the application of music in medical therapy and in prevention. Our 2-year series on music in the brain has been generously funded by the Dana Foundation. For this weekend's events, we're also grateful for the support of the American Music Therapy Association. I would like to acknowledge the president of the association, Ronna S. Kaplan, director of the music therapy program at the Music Settlement in Cleveland, and the association's CEO, Dr. Andrea Farbman, if you would like to stand for a moment. Just outside the door, you'll find a table at the back with some information about tomorrow's stress reduction workshop, which you might possibly need, with Ann B. Parker, also a music therapist, and Donald DuRousseau from Human Bionics, LLC. Also, we have biographies of tonight's speakers. And now, please welcome Dr. Jayne Standley.
Those of you that have been sitting here for the last few minutes have probably heard way more than it's been a hard day's night than you ever wanted to hear before. I thought in doing this presentation it would be really great to show some videos, but we're going to have some sound difficulties, so maybe we will just give an example of the sound and then keep the volume down to keep the buzz out of the feedback for the video examples. It's an honor to be asked to speak in this magnificent building. I was a tourist all morning looking at the Library of Congress, and it's a fantastic repository of the world's knowledge, the world's largest library, and it's a phenomenal occasion for me to be here. I thank you all for coming. This is a favorite topic of mine. I'm going to focus tonight on medical music therapy and how music therapy affects the brain. I have been doing this for a number of years, and I am speaking to you as both a researcher and a music therapist. So I'm going to talk a bit about the career of music therapy, which developed in the United States over 60 years ago. Music therapists use a variety of therapeutic and psychological skills combined with their vast music talent and repertoire to do interventions with people in a variety of settings. People say, well, why don't you just use recorded music? You know, like if you have a headache, you take aspirin. If you're sick, you take a little Mozart or Beethoven or whatever. Live music has that powerful interaction with the therapist and is in the moment. So as the environment changes, the therapist can change to match what the patient might need or what the client might need. You heard that one of the sponsors for tonight is the American Music Therapy Association. Its purpose is to advance public knowledge about the field and to improve access to quality music therapy for everyone. In the United States, there are over 4,000 members. It's a very, very active group with many degree programs throughout the United States. The music therapist practices at the bachelor's level. There's a 4-year curriculum of music courses followed by a 6-month internship. Then one may specialize at the master's level, and if you wish to be an academic in the area, you would get a PhD. But you also need those years of clinical experience to be approved to teach in the academic programs. There is another national organization called the Certification Board for Music Therapy. It provides a national test for quality control for consumers of music therapy services, and one is eligible to sit for the test by virtue of finishing the degree program. If you pass the test, you use the initials MTBC, Music Therapist Board Certified. So we are nationally certified, degreed professionals, the only professionals in the United States practicing music therapy. Music therapists work in a variety of areas. Historically, we started in mental health. When children with developmental disabilities went into the public schools, then the field of music and special education greatly expanded. Today, medical music therapy is one of the most rapidly expanding areas, and that's what I'm going to focus on tonight. When one is studying music therapy, one minors in psychology and takes a number of courses, human anatomy and physiology, and learning about the effects of music on the human being, and one specializes in the psychology of music. What is it about music that makes it so therapeutic? And all cultures use music in healing endeavors. Music is acoustically different from all other stimuli. It evokes pleasurable responses from the brain. The brain processes music. Because it occurs across time, the brain begins to collect information and set up expectations about what will happen next. Your brain expected me to finish the sentence, and you were disconcerted by the fact that I did not. Music has that same ability over time to set up expectations, and when the resolution comes, we say the tension in the music resolves. There is this warm, wonderful feeling that the body has physiologically. So music changes a person physiologically across time. It causes pleasurable hormones to be excreted. That can be used in medical practice, but it also evokes strong emotional responses, and so we use those ideas, those principles in mental health and counseling and music therapy. The Hard Day's Night example is coming up. I wanted to use this as an example of the demonstration that the brain enjoys listening to music so much, it will focus such strong attention that the perception of pain is changed. A person listening to music will not perceive as much pain. This is a post-surgical patient. The principle of music therapy is based on music preference. The music therapist had ascertained the patient's pain level. He's going to tell her it's at about 9, and then she had ascertained his preferred music. She is going to sing to him in his preferred genre, continuous music, for about 20 minutes. I'm not going to play all of that for you.
Probably about a 9?
Yeah.
Okay, well, we'll play some music and you just take a deep breath in through your nose and hold it and breathe out through your mouth.
Okay.
It's been a hard day's night, and I've been working like a dog. It's been a hard day's night. I should be sleeping like a log.
When she sings to him continuously for about 20 minutes, you will find, the research will show, and this patient will find, that he reports his pain level down to about 4 or 5 with no additional medication in his system. Research also shows that this patient will use less analgesic medication following his surgery while he's in the hospital. He will go home sooner. So not only does music improve the quality of medical treatment for the patient, it actually reduces costs for the hospitalization of the individual. It also helps avoid some of the side effects that using multiple dosages of medications and multiple medications can cause. So music changes perception because it focuses attention so profoundly. But music has a powerful impact on cognition also, and we use this principle in teaching information to music. Information that is taught to music is embedded in a different part of the brain and is accessible through different mechanisms. So if there's an injury to the neurological system, sometimes we can bypass that by teaching new information or new skills like motor skills or speech skills with music and be able to access abilities through that mechanism. Oliver Sacks is very famous. He's a very famous neurologist, and he has pointed out repeatedly that studying music actually changes the structure of the brain. When you devote hours to the performance of music, the interpretation of reading music, and listening to music, the center part of the brain, the corpus callosum, actually enlarges. And musicians who have studied music for years actually have 3 parts to the brain instead of 2 hemispheres with some connective tissue. So the discipline of spending a great deal of time with music restructures the brain. One of the other things that we have learned is that music information embedded in that very deep center section of the brain stays with one for a very, very long time. Even in Alzheimer's disease, it is not unusual that music memories learned in early childhood remain through the latter stages of Alzheimer's, and sometimes are more apparent to the individual than recognition of their family members or other information that they learned in their lifetime. This is a particularly exciting time in our field because the field of neuroscience has discovered music. The basic research that is being done with the fMRI, looking at the image of the brain while the person is still functioning, has taught us more in the last 10 years about the human brain than we knew throughout the lifetime of mankind. And so it's a very profound time to be studying what we have always known as music therapists clinically, that we can observe changes in individuals, but now we can have that X-ray or image of the brain to tell us exactly what is changing and what is responding in the brain. Here's an example for you. This is one of our most famous music therapists, DeForia Lane, who practices in Cleveland, and she's interacting with a young boy who had brain surgery. You'll hear his mother say that he lost all abilities, his motor abilities and his speech abilities following surgery, and in rehabilitation received music therapy. You're going to notice how effectively that he sings and is able to speak at this point in time.
Me out to a ball game. Take me out with a crowd.
Brian's illness really started 4 years ago with his first surgery at the age of 8 when they diagnosed a brain tumor out of the blue. It was a very complicated surgery, and he had a lot of complications afterwards. Lost everything neurologically, including his singing ability. He couldn't even speak or move anything at all.
It's 1, 2, 3.
Well, Dr. Cohen said that when he came in, he said, "So how are you, buddy? How you doing?" And instead of talking, you sang. Would you sing that for me?
In scripture, huh?
Mm-hmm.
I believe in the sun, even when it is not shining, and I believe in love, even when there's no one.
Another principle of music therapy is that listening to music actually helps one be better coordinated with regard to motor skills. Muscles move with greater fluidity and with greater rhythm. It seems that when the brain doesn't have to make that plan for the movement, when the rhythm is providing a plan, that people have more success. We use this principle in helping people with neurological rehabilitation. This is a Parkinson's group. The gentlemen are having difficulty with gait, shuffling of feet, unsteady gait, balance problems, and they are learning to dance. This is a tango that they're working on.
Pattern. Ready? 1, 2, 1.
You will notice
Start.
their gait is less steady
Forward.
when there's just a
Forward,
voice
side,
giving a rhythm
together.
than when the
Forward.
music starts.
Forward, forward, side, together. Good. Forward, 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 side, together. Last time. Forward, 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 side, together. Wonderful. Stay where you are. You ready? 1, 2, 1, 2, ready, go. Forward, 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 side, together. Forward, 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 side, together. Forward, 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 side, together. And forward, forward,
wonderful thing is that the brain can remember what the music sounds like, and all you have to do is think about the music, and that motor coordination ability will still be here after the music is faded. We, of course, don't want these men walking through life with the tango music in the background, but their wives are pleased that they've learned to dance when we're doing this. We have a partnership with our local hospital between Florida State University and Tallahassee Memorial Healthcare, and we have music therapy throughout the hospital, a variety of medical objectives, everything from the examples I've already showed you about reducing pain or anxiety in treatment to helping women in childbirth. Research shows that using music to focus attention away from the labor pains actually reduces the perception of pain. Women relax more, and they actually have the babies about 2 hours faster. Most women are very pleased to hear about that possibility. I'm going to focus the rest of the time that I'm speaking on what we do with children. Children are traumatized by medical treatment. Research has shown if you were just starting an IV line or you were doing a bone marrow injection, the medical community would think that the bone marrow is much more serious and more painful, but children are equally traumatized by the two. They can't tell the difference, and they think that it's their fault. And so children are not cooperative with medical treatment. They are frightened. They developmentally regress, and music therapy is a wonderful way to deal with some of those issues. I'm going to show you two procedural supports. This is a CAT scan. It starts in the waiting room. We sing the baby to sleep, or the child to sleep. We use different music, of course, for different ages. And the music therapist is going to accompany the baby into the CAT scan room. The baby will sleep through the test and therefore will not be moving around and will not need sedation. In our hospital, we have stopped using sedation of children for all testing and assessment procedures. This pediatric procedural support with music therapy is very, very important because the sedation for children has very terrible side effects. Sometimes they're life-threatening side effects. And when a child is sedated, an RN has to be present for the entire 2 hours that the medication is in the system. This is an EKG. Instead of singing the child to sleep, we're using alerting responses. You can see the child's heart beating in the upper right-hand portion of the screen. The technician has a mouse that's going over the child's chest. The music therapist is going to change the music instrument that she's holding in the song that she's singing every 15 seconds to distract this child. As long as the child is distracted, there's no problem in giving the test. So we help children sleep in the hospital. We reduce trauma. There's a great deal of respiratory distress and children's illnesses. We work with that a great deal. And another thing that we do is help children become cooperative and learn to move around after surgery. This is the child that had a brain tumor. He's just out of surgery. He's supposed to get up out of bed, move around. He was uncooperative. They phoned for the music therapist. His sisters came to visit in the meantime, so this is a family interaction. You will see that he's participating, but it takes a few minutes for him to actually sit up and begin attending to this activity. But what I want you to see is the difference in his mood after he does start attending. Okay, here we go. This was a 30-minute music activity, and by the end he was out of bed dancing and participating with his sisters in the wave. I'm going to stop for the sake of time, but he gets more and more involved, and that was the purpose of the activity. As the tempo of the music gets faster, he becomes much more animated and begins to sit up and actually get out of bed to be able to play his instrument. We also work with children with developmental delays doing rehabilitation objectives and children who come for day treatment or for outpatient status, and we're doing typical rehabilitative objectives similar to what we do with adults. My particular area of research is premature infants, so I wanted to talk for just a moment or two about what music therapy does for premature babies. We have found that it improves oxygen saturation, meaning the baby begins to breathe in time to the music, breathes more deeply, and needs less oxygen provided. That's good because too much oxygen causes damage to the eyesight that is permanent. So that's a very important issue. We also find that babies listening to music go up home from the hospital about 2 weeks faster than babies who do not have music. That's an important variable because the babies are nurtured better in the home than in the hospital where the lights are on 24 hours and where there's too much noise and medical equipment or whatever. We also have developed procedures for increasing weight gain. One of the devices that I invented was a device to help children learn to feed. A baby can be born at 24 gestational weeks, 3 months early, and the neurological system is too immature for the baby to be able to feed by mouth, so the baby's tube fed. About 10 weeks later, at 34 weeks, the baby's now ready to learn to feed by mouth, but it has no rooting reflex, and now it needs to be taught, but it's not highly motivated to do that. So this becomes problematical, and sometimes premature babies are in the hospital simply because they want feed. We found out that if you connected a pacifier to an air pressure transducer so that when they suck, it turned on electrical equipment that played music to reinforce sucking, that sure enough, it reinforced sucking. And it currently looks like this device. There's a green nipple. There is a computer chip inside this insert that goes into the nipple. This is an infrared light source that is going up to a receiver on the outside of the incubator that plays music from the CD player. We found that the babies could tell the difference. 34-week babies, they are still a month early. That means an 8-month gestational baby could tell the difference when the music was playing and when it wasn't. They would suck in response to the music. We then did an experiment where we gave them a practice opportunity after the morning feeding, before the evening feeding, and what we found out was that it actually improved the feeding rate. You can see that in the afternoon, the feeding rate for the group using the pacifier was much higher. For the control group, it was actually lower. The university has patented this device. It has FDA approval to teach feeding to babies, and it's in commercial development. We have also found that it's more effective than a typical pacifier or just listening to music in reducing stress after painful treatments. The babies are stuck with needles and they have open heart surgery, gastrointestinal surgery. There are all sorts of painful medical procedures. Brain cells actually quit dividing in the neurological development of the babies when they are submitted to great pain and stress. So we have found that this pacifier helps them go to sleep faster and brain cells can start dividing again more quickly. One other procedure that we do combines lullabies to soothe the infant with massage for neurological tolerance of expanding levels of stimulation. And it starts with pacification of just humming lullabies. This is a 3-pound, 34-week premature infant. And the humming puts the baby in homeostasis or very sedate state, and then massage can start. It starts at the top of the head because that's the way the neurological system develops, from the head down, so the baby is more ready to receive touch at the top of the head. This procedure takes about 15 minutes, and what we're trying to do is avoid overstimulation where the baby would startle. Again, brain cells quit dividing if the baby startles. So really what we're doing is pacifying the brain and teaching the brain that it can tolerate accumulating levels of stimulation. This is one of the studies we'd love to see neuroscience do. We can see that the babies are discharged sooner. We can see neurological maturation and behavior change, but we would love to be able to look at the brain and say, look, this brain is more neurologically advanced as a result of this study. At Florida State, we have a National Institute for Infant and Child Medical Music Therapy. Our purpose is to do research and to demonstrate innovative clinical projects. And so it was an honor to speak with you today about what our particular interests are in this area. Thank you so much.
If you have any quick questions for Jayne Standley while we're doing this, I don't want to waste any time. Anybody have a question for?
how did you determine which music was most effective for the premature babies? You said.
Right. Whenever you start an innovative procedure, you have to go to the research to find out what's already been done. And so there was a great deal of research to show that lullabies of all cultures are designed to soothe babies. And that was the overall objective, is to soothe the infants, because they need nurturing and they need to gain weight and they need to sleep deeply in order for brain cells to develop. So lullabies, first of all, and then we did a variety of research projects to actually find out in what key, how many chord changes, because every time the music changes, it's an alerting stimulus, and we were reducing alerting stimuli, which is how we got down to particular compositions with just humming in the beginning for the most critical babies. Now, by the time the babies are discharged and going home from the hospital, they're equivalent to a term infant, and they're going home with the radio on. In one of our discharge meetings, they were talking about a baby who had 4 teenage siblings, and every one of them had their own sound system in the home. So we also have to help the baby make a transition to be ready for the acoustic environment they're going to go into.
This has been a presentation of the Library of Congress. Visit us at loc.gov.